our routine ciprofloxacin and levofloxacin actually works better for UTI till date than cefixime does. So, in as much as we continue to use our quinolones, which has always been our first line, but the degree of resistance to it is significantly rising. And we have situations where we are now having to treat our patients with expensive antibiotics, coupled with surgery fees, admission fees. So treatment is getting more and more expensive, and as such, selecting a few, because those that cannot afford it will either develop natural way of treating it or succumb to it. And this is worrisome, and it's not good for all of us. Because definitely we have relatives, we have friends, we have people, human beings in the society who cannot afford these drugs. So a collective approach and effort to stop it will definitely help. And lastly, before I sit down, I would like to remind us, this again goes to now policymakers. Like I said, everybody has a role to play. I first drew attention of the patient on the street, the patient on the ward, even we as doctors, to be fair, especially maybe less experienced ones amongst us who practice. Sometimes not just the experience, I will also say even work overload, to be fair to the people involved. One person seeing too many patients. So anybody who just comes, wider antibiotics, fever antibiotics, he has no time to go through the processes to determine what exactly could be the problem. Overwork is there, but sometimes inexperience is also there. Now, coming to the policymakers, just to drop this before I go, there is no way, I think, on my own part, we will win this war for as long as patients pay out of pocket. Out of pocket payment for health is very expensive. And nobody, even amongst us, compared to the society, we seated here are seen relatively as the middle class. But even amongst us, we pray not to fall sick, because health treatment is very expensive. And as such, until we find a way to pay for health collectively, not individually, things like this will continue to trouble us. Thank you.
Thank you very much, Dr. Khalifa. That